Hello, my name is Olivia Ming. My pronouns are they, them. And today we're going to be talking about trauma-informed care. So, before we begin, I'd like to give a little trigger warning because we're going to be discussing topics of childhood trauma and also this can include sexual abuse, racism, oppression, homophobia, poverty. I'm not going to go into much detail, but there's going to be a lot of mentions of that. So take care and let's dive into it. So before we kind of get into trauma-informed care, I want to kind of give a refresher of what trauma is. So it is an incident or series of events that are disturbing or life-threatening, causing lasting adverse effects on mental, physical, emotional, or spiritual well-being. A lot of this data is coming from the Trauma Informed Care Resource Center, and their data is from 2025. I'm just going to read off the traumatic experiences um, that are included here, but are not limited to poverty, childhood neglect, sudden unexplained separation from a loved one, racism, discrimination, and oppression, physical, sexual, and emotional abuse, and living with a family member with a mental health or substance use disorder. And a lot of these things can occur at the same time, or at different times and cause different types of compacting trauma. So let's now discuss adverse childhood experiences. So these are also known as ACEs. So from now on, that's what I'll be saying. So this is trauma that occurs in childhood that has long-lasting effects on the developing brain. So we just discussed in the previous presentation about development and developmental age. A lot of our guests have been through a lot of adverse childhood experiences, at least one, a lot of times multiple. So they now you kind of can see the percentage of that, and now you know how that affects development. Oh, sorry. Okay. Um, so 62% of US adults have at least one ACE, and 25% of US adults have three or more ACEs. And on the left here, you can see all of the populations that have an increased risk of experiencing an adverse childhood event. So, how do ACEs impact people? So, they are two times as likely to smoke, two and a half more, two and a half times more likely to have an STI, four times more likely to have chronic obstructive pulmonary disease, which is a respiratory disease that's caused by chronic smoking, typically. Um, seven times more likely to consider themselves an alcoholic, 10 times as likely to have injected street drugs with the needles, 12 times as likely to have attempted suicide. So, um, my little face is covering the title here. So if y'all can't read it, it says young adults who identify as LGBTQIA plus and are unhoused. So this graph seems a little confusing, and honestly, it kind of makes my brain go, "Woo, what?" So I'm going to explain it a little bit. But first, what it is, so it's Chapin Hall at the University of Chicago conducted a study on risk factors and prevalence of specific ACEs in LGBTQIA plus young adults experiencing homelessness. So they found here, so as you can see, the LGBTQ community is in orange, non-LGBTQ is in maroon. So you can see here how much of a difference the margins are between the two groups. So, and some examples, um, some really good ones exposed to discrimination or stigma within the family. 64% of LGBTQ plus individuals have experienced that compared to almost half of that, 37%. And then also physically harmed by others, forced to have sex. So we see these things are definitely impacting the LGBTQ population who are unhoused, who are young adults disproportionately to their non-LGBTQIA plus peers. One more thing to highlight from that Voices of Youth count of Chapin Hall at the University of Chicago, they found that young adults who identify as LGBTQIA plus are 120% more likely to experience homelessness compared to their peers who do not identify as LGBTQIA plus. So now we know what trauma is, adverse childhood experiences, how trauma affects the brain and the developing brain. So let's talk about what trauma-informed care is. So it's a framework that recognizes the impact of trauma and focuses on creating a healing and supportive environment instead of ones that could unintentionally cause more harm. And a lot of times it is unintentional. So, for example, in emergency shelter, an example of a trauma-informed care, trauma-informed practice would be to we make bedrolls in emergency shelter instead of putting them in a pillowcase because that's how they do them in prisons. And in the past, a guest has said that, and Launchpad has changed it immediately. So, you know, we're all learning together. And I'm gonna give two examples of like a trauma-informed practice within mobile housing. So, for example, conversations about food, how much they're eating, if they are hoarding, any food in their rooms. Um, kind of the staff at Launchpad know that this is a response to previous food insecurity. So coming across it with less judgment and just more questions about if anything's going on. And then um, one more example. So if a guest is acting confrontational or upset, understanding that those reactions are coming from them being in a heightened state of emotional stress for sometimes very long periods of time. So staying trauma informed in the way you respond, responding calmly to situations such as those. So this is a very important piece to this whole thing, compassion fatigue. It's so important to look after yourself, especially in a helping profession, which that is what Launchpad is. You're in a helping profession. You're lifting these young people up, young adults up. So, compassion fatigue is when people who help others, like healthcare workers or therapists, become physically and emotionally exhausted for caring for people in distress, which is a lot of times what Launchpad is. So it's like feeling worn out or overwhelmed because of constantly being exposed to other people's pain and suffering. So over time, it's harder to effectively give empathy and even muster it within yourself for these people because you're so overwhelmed. Um, and I just really want to point out that this is different from burnout because it's specifically relating to the emotional toll of taking care of others. So also you'd hear it, you may have heard it referred to as empathy overload. So I've also experienced this before. Um, honestly, I think 2 to 3 times in my life, or yeah, I've experienced it before being in a helping profession. Um, and these are some things that have helped me and They are researched ways that are very simple ways, but very effective. So here are some tips for overcoming compassion fatigue to keep in your brain throughout your time at Launchpad and throughout your life. So prioritize self-care tasks, prioritize you, whether that is diet, exercise, and mindfulness. Sometimes diet and exercise can be a triggering thing for people with previous, eating disorders or something, but just if that's a healthy thing for you, taking time away from work, even if it's just a day or two, and also communicating with your boss and your fellow employees. How can you support them? How can they support you? Keeping that mental health talk open, I think, is very important. Find your people. Sometimes that's hard, but once you do, really foster those connections. Find your hobbies. If you're having trouble with that, just try a bunch of new things. And yeah, I discovered puzzling this year, and it really helped when I was experiencing this at a hospital. So yeah, and mental health services. I cannot stress this enough, and I hope all of y'all understand the importance of mental health services. I myself am in therapy weekly, and it keeps me prioritizing myself while also making sure I'm um, getting, obtaining my goals and staying happy and healthy. Okay, thank you. And I wanted to put this quote up here. We are powerful because we have survived, Audre Lorde. Um, just be proud of yourself and keep yourself in mind while also keeping the guests in mind and their trauma. So, yeah, here are my references. And up next, we're going to talk about motivational interviewing. And that is kind of the big lesson to take out of this. So, yeah, thank you.